Hello everyone, welcome back to my channel. Welcome to Walk with Anxiety. Today is episode number 2. Today's video to me is going to be the most important video of my channel because it gives you the overall understanding of anxiety. Okay, like why you have them and what happens to you when you have anxiety. So let's get right into it. I want you to look at this bottle of water, okay? And this is you before your anxiety disorder. This is a normal person, okay? Now, this is your sensitivity level. This is your stress level, okay? And this is ideal if you can leave it right here. But as a person who constantly worries about everything, or living with an abusive husband, an abusive partner, okay? Or you're going through some financial hardship, or you witness something very traumatic in your life like me. I witnessed my dad had a stroke right in front of me. And 6 months later, I witnessed my entire family was like passing out on the floor because of carbon monoxide poisoning. So to me, those are the cause that raise my stress level. But you know, some people, they don't experience anything traumatic, but they experience a constant stress in life. Like they hate their job. You know, their parents are really mean to them, or they always feel lonely, or they're being bullied at school. You know, those are the daily stress that's adding on top of each other, and this one day turned to this. Your stress level, your sensitivity level is up to the brim of the bottle. And understand, guys, once the water spill out of the bottle, that's when you start having symptoms. Okay, once the water gets released from the bottle, it activates your nerves to start firing signal to trigger and activate the flight and fight response. So you feel all the sensation in your body, which a lot of people say it came out of the blue, but it didn't, because their stress level was rising from here to here without them even noticing any symptoms. So they thought that it's just life, you know, they're fine with it until the day there's no more space for stress. So it spills. Once it spills, you start having headaches, vision problem, heart palpitation, shortness of breath, dizziness, you know, all kind of physical and mental symptoms. And then it worries you. Once it worries you, you put the stress right back into the bottle, it spills again. What do? You know, you're trying to suppress it. You're trying to think, oh my God, what I'm gonna do now? I'm gonna go to the hospital, I'm gonna die, I'm gonna having a seizure, I'm gonna pass out, I'm gonna have a stroke. Those kind of thoughts trigger your body to release a flood of adrenaline back into this bottle, and it erupts like a volcano, and that gives you a panic attack. That's all it is, okay? People who are at this level, your nervous system is extremely sensitized. Any little stress can cause symptoms. Okay, people say, well, I'm not stressed. I'm just sitting home watching movie, and then boom, my heart stopped beating. You know, like I feel like I couldn't breathe out of nowhere. It's not out of nowhere because it depends on how you define stress. Stress is not necessarily something that you have to worry about. Okay, let's say you walk up a flight of stairs. That's the physical stress you put on your body. You know, like if you eat too much, that's stress to your stomach. You watch a movie that is too emotional, too suspenseful, that's stress as well. And when you are at this level, it only takes that much for the water to spill. And then you start having symptoms. And when you have symptoms, without understanding that, you know what, I'm sensitized. So the symptoms I felt was caused by my sensitized nerves, because, you know, like any little stress now can cause me to have symptoms. You don't understand that. So that's why you go into more negative thoughts at, you know, maybe I'm having a heart attack, maybe I'm having a seizure, maybe I'm having a stroke. You know, oh my God, my hand's numb, so that's a sign of stroke. But once you understand that sometimes when your hands are numb, it's just because maybe somewhere in your day that you experience stress that you don't know, you know, and it triggers your nerves because the water starts spilling out and makes your hands numb. But since people don't understand that, they put the stress back right into this bottle. and the bottle spill again. So they get stuck in the anxiety cycle. And then is when you have an anxiety disorder. So to get out of it, the only way to get out of it is not to worry about each and every single symptom, but the way to get out of anxiety is to try to lower your stress and sensitivity level. That, to me, for the past 10 years that I've helped people and study about anxiety, that is the only way for you to cure anxiety. What you do is, if you take medications, remember, I'm not a doctor, I'm not a medical professional, I'm not a licensed therapist guy. So what I'm telling you is just from my personal experience, okay? Medication will put a cap on it to prevent the water to spill, so you don't have symptoms. So many people take medication and they say, well, it helps, But then one day, that cap gets blown off and you have a panic attack. You go back to your doctor. What did he do? He give you a bigger cap. He up your dose of medication. So now they suppress it again. And you just go on and on and on, increasing and switching your medication and feel like it's not working. Like, I'm still having anxiety and panic attacks. That's why. You're not working on lowering your sensitivity level, but you are working on suppressing it, and that won't work. I've never seen it work for anybody. Okay? Now, you might ask, like, how do I lower my sensitivity? How do I desensitize my nerves? Well, I have a good news for you. Your nerves and your body desensitize it themselves. Okay? The only condition that you have to have is to stop adding more stress to it. And it is extremely difficult to do, because when your heart starts pounding, there's no way you can be like, just forget about it. It's nothing. Or to me, now I can do it. But at first, when I went through what you're going through right now, there was no way in hell I could talk myself out of worrying. Okay, so I continue to add more stress and more stress to it. So it takes practice, guys. It takes persistence and some courage. Okay, but first, go get checked out by your doctor. Okay, just to get a clean bill of health, so you know that nothing is going on, nothing is wrong with your body. From then on, every time you have a physical symptoms, please remember this bottle and remind yourself, my water is just spilling. Okay, I will not put any more stress back to it. I will not react to it, so that it can desensitize itself. Okay, and some people are able to bring the level like maybe up to here, so they can go weeks and months without any symptoms, and they think that they have recovered from anxiety. So they stop working on their anxiety. Guess what? It's creeping back up, and one day when they have a symptoms, they have another panic attack, they think that they fell, but they actually didn't fail. That is called a setback. Okay, setback is when you can go weeks and months, sometimes years, without having any symptoms, without having any anxiety, and one day it creeps back up to you. It's because you feel comfortable and you forgot that you have to constantly work on your stress level. Okay, guys, so next time when you have a symptom of anxiety, please just remember this bottle and remind yourself that after years or months of stress, your level is up here now. Okay, and it's okay to have symptoms. The water just spilling a little bit. There's no need to put more stress back to it, and there's no need to activate that flight or fight response, which will cause you a panic attack. Okay, and if you happen to have a panic attack, and I will make a video to show you how to overcome it, because you can talk to anyone who recover from anxiety and panic attacks. They will tell you as their recovery go, panic attack is the first thing that go. Okay, the first thing you can manage or you can get rid of are the panic attacks. It's very difficult, but it's doable and it's very possible. Okay, guys, and I hope that I can give you the understanding of why you have anxiety, of why symptoms keep occurring. Okay, and it will help you to take away the fear from the disorder, and that's half the battle, is to take away the fear. Okay, guys, I hope it's helpful, and if you like the video, just give it a like and subscribe to my channel, and I will be making more videos for you. Okay, you have any questions, just comment below. Remember, you will and can recover. Thanks, guys.